Good morning, Miss Agnes. I would like to go through your medications with you if that's okay. I just want to make sure that everything that we have in the computer is correct and that our list matches what you have in the home and just ensure that there's no discrepancies with your medications or anything like that. Um, would you mind going and getting your bottles and stuff for me, please?
Oh, yeah, sure. Let me go get him. I'll be right back. Just 1 second. Okay, I'm back. I got him. Here you go. Here's my whole tray of meds. This is everything that I take, okay? Just let me know if you got any questions. I know everything there is to know about him, all right?
Oh my goodness. Okay. Yeah, do you care if I take a look at the tray? Um, Also, I see you have like a lot of prescription bottles in there, and there looks like there might be like a couple of like over the counter things, like some vitamins or something like that. Do you have any other medications that are over the counter, like any other supplements, eye drops, or like any inhalers, anything like that? Because I do have to see everything, including stuff that you only take sometimes, like even like Tylenol, ibuprofen, stuff like that.
Oh, yeah, for sure. Just 1 second. I do have a lot of other, uh, what you call it, over the counter stuff. I take a lot of vitamins and supplements and things like that. So let me go get him. I'll be right back. It might take me a second because there's a few of them, okay? Here you go. There's one of them that I got. There's a bunch of stuff in here. And then 1 second, I gotta get the other one. Here's the other one. I got a lot of stuff in this one, so I don't take all of these all the time, but I do take a lot of them, that's for sure. Oh, and I forgot my Tylenol and my ibuprofen. Here's my Tylenol and my ibuprofen. And I forgot these two. These are my multivitamins. Don't want to forget those. Anything else you need? I think that's finally everything.
Oh my goodness. Okay. Yes, that is quite a lot of medications. So yeah, I will need to go through all of those and make sure that I document everything I have, and I'm gonna kind of need you to go through and tell me what you take and how often you take it, with respect to like the vitamins and the supplements and those types of things. Do you think you can do that for me?
3 hours later. What is this one? I can't see it. 1 second. Oh, this is my allergy pill. I only take this one every other day, or maybe like a couple times a week. Not every day. I don't think I need it every day. But yeah, that's my allergy pill. And let's see what's next. The, oh, that's my vitamin D. I take that for my bones, I think. I'm not sure. At least that's what I think they told me. I take that one every day. And I think that's the last of them all. No, I'm pretty good, huh?
Yeah, Miss Agnes, I'm actually pretty impressed. You do seem to know them pretty well. Um, there were a couple of issues that I noticed though. So, um, these three are the same medication and they're all three different doses. And you didn't seem to be sure which one you're taking, and I don't have a clarification in our record for you which one you take, so I'm going to have to call the doctor and clarify that to make sure that we get the correct one. And once I figure out the correct dosage, we'll come back and make sure and sort this out for you so that you don't accidentally take the wrong strength, and that you don't duplicate since you have um, three of the same. We don't want you accidentally taking, one from all three bottles. So what I'd also like to do is get you set up with a med box that I will fill for you. Once I get a call back from the doctor, I'm going to go ahead and pre-fill what I know now, and then I will come back and pre-fill the correct dose of this once I am sure which one you're supposed to take. Okay, that sound good?
Oh, yeah, that's fine, honey. Go right ahead and go ahead and call the doctor. I'm pretty sure that it's the orange one that I take, though. The whatever one of those is the orange one, that's the dose or the whatever you call it, the milliliter, milligram, whatever that I take. Pretty sure.
See, Miss Agnes, unfortunately, that strategy is not going to work because all three of those strengths, those three bottles, um, they're all orange. So unfortunately, we still need to call and clarify with the doctor. So I'm going to do that really quickly while I'm here, okay? Hi, my name's Meredith. I'm a nurse calling from IU Home Healthcare, and I'm calling regarding Dr. Johnson's patient, Agnes Smith, date of birth 1/1/47. And I'm calling because I'm here with her currently in the home and was doing a medication reconciliation, reviewing all of her medications that she has. And I noticed that she has three different strengths of lisinopril in the home. She has 2.5 milligrams, 5 milligrams, and 10 milligrams. And the 10 milligram prescription looks to be the most recent one according to the bottle. But my records show that she's supposed to be on the 5 milligram. So I was just wondering if someone could please give me a call back while I'm in the home. That way I can correct her med box is what we're going to do for her. I'm going to pre-fill them so that while we're doing her education to make sure that she doesn't have any errors. But if someone could please give me a call back pretty quickly while I'm here, I will go ahead and get the correct dosage in her med box. And if I don't get a call back, then I will come back later quickly just to correct that med box for her. So if you can give me a call back at 765-212-5065. Again, this is Meredith with IU Home Care calling regarding patient Agnes Smith. Thank you so much. 15 minutes later. Hi, yes, this is Meredith with IU Home Care. How can I help you? Oh, yes, hi. Thank you so much for giving me a call back so quickly. 10 milligrams? Okay. I will get that set up in her pillbox for her so that she has the correct dosage and we'll get our records updated. Thank you so much. Appreciate it. Have a good day. Bye-bye. All right, Miss Agnes. So that was your doctor's office. They just called me back, thankfully, very timely, and they said that you're supposed to be taking the 10 milligram tablet. So I'm going to get the 10 milligram, and I am going to get rid of the other prescriptions for you so that you don't accidentally take the wrong one if you, for some reason, get your bottles mixed up. I'm going to preset your med box for you, so you don't need to worry about it. But I still don't want these incorrect strengths in your home in the mix with all of your other bottles, so that it's just more assurance that there won't be any error. Okay, so I'm going to go ahead and get your med box all set for you, and then we'll be all finished for the day. Okay, so now I'm going to document my medication review and the findings that I had, that there were some discrepancies and unclear dosages on Miss Agnes's medications. So I'm going to document that. I'm going to document that I reached out to the physician with the questions on the clarification, and then I'm going to document that I got the return call, who I spoke to, what time I spoke to them. I'm going to document what that order was, that the clarification was that the 10 milligram tablet of lisinopril was the correct dosage, and I'm also going to document what I'm going to do about that correction afterwards. So I'm going to document also that I pre-filled her medication box with the correct dosage and that the medication list was updated in the clinical record. And it would also be a good idea to make sure that you let the other clinicians that are caring for this patient know that as well. So sending an email or something, like especially if you're not the case manager, that's always a good idea to let them know that you updated the medication list and that there was a change. And then you should be good to go.